Blessed love, my Lord and Empress, give thanks for life, and the mighty life giver, Holy Emmanuel I, King Selassie I, Jah,
Yeah.
Rastafari. This is the African Liberation Network, and I'm the host, Rebel Prophet Daniel. And this is the Health, Strength, and Restoration Program. And tonight's topic is from birth, from conception to birth, from egg to embryo. Yes, so at this time, I'll turn it over to the Honorable Prophet Jacques Clarkey to say a prayer to begin the program, my Lord.
Let's give thanks, my Lord, our strength and power, and enough blessings. The Marcus I, Emmanuel I, Selassie I, Jah, Rastafari, every alien the hour of our strength and power. Here and the words of our mouth and the meditation of our heart be acceptable in thy sight. We hail the mighty God of 11 Father, and we cover them banners of the red, gold, and green, alongside the red, black, and green. With the black 5-point star with the land and the half symbol respectively. Glory be to our Father, and to the Son, and to the Holy One of creation, which was in the beginning, now and ever shall be, a world without the Most High, Selassie I, Jah. Rastafari. Continue on reading the 133rd Psalm, Mighty King David. Behold, how good and how pleasant it is for brethren and sisters to dwell together in unity. It is like the precious ointment upon the head that ran down upon the beard, even Aaron's beard that went down to the skirts of his garments, as the dew of woman dew that descended upon the mountains of Zion. But there the Lord commanded blessed even life forevermore. Most High, Selassie I, Jah, Rastafari, all blessings and strength and power, my Lord and Empress, all your viewers. Heart of love to the angel. Who hand over the floor to the Royal Empress, my love.
Give thanks, Jack Clark. Give thanks, John Daniel. Give thanks, family. Glorify the prayer, go through. Give thanks again for another night, of Health, Strength, and Restoration Program. I am Empress Miriam, giving God thanks to be with them once more. The African Liberation Network family. We give thanks, for all our listeners. And so tonight, I will be singing a hymn to open the program as usual. And I'll be asking the Honorable Prophet Daniel to track the hymn for me. Blessed love, my Lord and Empress.
Glorified, Honorable Empress. So before we start, Mama, what we gonna do? 2 and then chorus, and then 2 and then humming, and then the first and last, and bring it down. Is that how you want to do it?
No. We just go through, sing the first 2, we the last 2, and we come down. Are you not hearing me?
Yeah, I am. Love? Give thanks.
How we have a delay here?
Yes, I heard you.
Okay, give thanks.
I don't know. Can y'all hear me?
I'm hearing you.
Yes, beloved, I hear you.
All right.
Jack Pretty, Jack Lucky, you have the book?
All right, I think.
You have the in-book?
It's on the screen.
Okay, all right.
It's on the screen, Mama.
So if Daniel cut out, then somebody jump in fast with it, right? And if I cut out, somebody jump in and take over because the internet, they're not working properly tonight. Okay? All right, so let's go, Daniel.
Yes, sorry. Can the item hear me?
Very good. So far.
Yes, sir.
All right. Take great pleasure to continue with this, our hymn for this night of health, strength, and restoration. Hymn number 70, taken from the Black Christ Salvation Jerusalem Schoolroom Hymnal. When mothers of Salem their children brought to Negus, the stern disciples drove them back and bade them depart. But Negus saw them ere they fled, and sweetly smiled and kindly said, Suffer little children to come unto me. Holy Emmanuel, I, King Selassie, I, Jah, Rastafari. Yes, Mama. When mothers of Salem.
When mother of Salem, their children brought to Negus,
the stern disciples drove them back and bade them depart.
The turned disciples drove them back and bid them to depart.
But Negus saw them ere they fled.
But Negus saw where they fled and kindly said,
And sweetly smiled and kindly said,
and sweetly
Suffer little
children to come unto me.
For I will receive them and fold them to me.
I will receive them and fold them in my bosom.
I'll be a shepherd to these lambs, or drive them not away.
I'll be a shepherd to these lambs, oh, drive them not away.
For if their hearts to me they give,
for if their hearts to me
they shall
give,
with me in glory live.
They shall be in glory. For I
Suffer
say,
little children to
suffer
come unto me.
the little children to come unto me.
Chorus. Suffer little children to come unto me.
Suffer the little children to come unto
How kind
me.
was our Savior.
How kind was our Savior.
To bid these children welcome.
Who bid these children welcome.
But there are many thousands who have never learned his name.
But there are many thousand who have never heard your name.
The Bible they have never read.
The Bible they have never
They know
read.
not that the
They
Savior said,
know not what our Savior said.
Suffer little children to come unto me.
Suffer the little children to come unto me.
Oh, soon may the heathen.
How soon may the heathen
Of every tribe and
in
nation.
every tribe of nation
Fulfill thy blessed word
the blessed
and cast their idols all
word
away.
and cast their idol all away.
Oh, shine upon them from above.
Oh, shine upon them from above.
And show thyself a God of love.
And show thyself thy God of love.
Teach the little children to come unto thee.
The little children to come unto me in a holy Mount Zion, Zion, Zion high, Lord, holy Mount Zion, Zion, mighty Redeemer, wonderful Savior, Jehovah, Jah, Rastafari, cutting and clearing, my Lord and Empress, give thanks.
Turn it over to
I'll say a few blessings.
okay.
Yes, honorable family, give thanks again, as we said before, for another night of health, strength, and restoration, program. This is the final program for this season. So we give thanks, that, for each and every one, for the listeners, take time out of their busy schedule and to listen to I and I as we bring forward, health, strength, and restoration, to the families, Bobo Shanti family and the wider family, of the African Liberation Network. We do give thanks, for Honorable Prophet Daniel, our host, give thanks for his blessing and for the all here is with us, and give us, a slot on his, channel so that we could bring over this program. I hope and pray that this program was a blessing, to each and every one as we try to educate ones and ones and ourselves, about our body and how it make up and the different organs that make up our body and how it work, and the diseases that affect the organs and how to take care of it so our life can prolong more, and the herb and medicine that is there to help, our organs as it work for us, So we give thanks for the health, strength, and restoration family, our researchers. We give thanks for the Honorable Sister Rachel will be our next speaker, Honorable Empress Cindy, Honorable Empress Diane, and also Honorable Prophet Clarkey, who round up our program, each time. Now we give thanks to the Empress them, because it is not easy and they have things to do, but they take time out to do the research, and to bring the findings, to I and I so we can build ourselves, more and learn more how to take care, of our body, by eating right. Don't take in anything that is not right within our goodie. That is not good for us, And yeah, I will not say anything much right now because the whole program is there. We need to get on with the sisters them as they're ready to tell you more about, conception to birth, right? So we're going to talk about when you are pregnant, and the dangers tonight, of pregnancy. So I hope that you'll give a good listening ears, all the pregnant mothers, them who are tuning in, listen carefully of what our researchers will impart to the item tonight. Give thanks to just strength and power, cutting and clearing, Holy Emmanuel I, Selassie I, Jah, Rastafari. And then over to my first speaker, Honorable Empress Rachel. Take it away, my sister. Okay.
Blessed night to the royal family. Oh, give thanks, Honorable Empress Maisie, for the wonderful hymn, Mother of Salem, Daniel, give thanks, give thanks to the African Liberation Network, and give thanks for Empress Cindy and Empress Maisie, Empress Leon, and the Honorable Jack Lack. So, family, tonight, Well, we go in with conception to birth, egg to embryo. So we have the main reproductive hormones, we have ovulation, we have conception, we have the sperm, we have fertilization, we have implantation, we have the umbilical cord, we have pregnancy, and we have the trimesters. So family, I'll begin with the main reproductive hormones. Holy Marcus, Holy Manuel, Selassie, Jah, Rastafari. Give thanks. Give thanks to all the honorable viewers. Give thanks to the listening here each and every time. So I like to continue with the main reproductive hormones. The main reproductive hormones, estrogen, testosterone, and progesterone, are instrumental in sexuality and fertility. They are responsible for pregnancy, puberty, menstruation, menopause, sex drive, sperm production, and more. These hormones are produced in the ovaries in female and testes in the male. In the brain, the pituitary gland produces, stores, and stimulates the hormones controlling female reproduction. This includes the gonadotropin releasing hormone, which is the GnRH, the follicle stimulating hormone, which is the FSH, and the luteinizing hormone, which is LH. Family, or estrogen and progesterone are produced by the ovaries, corpus luteum, and human chorionic gonadotropin, which is the HCG. The HCG is the hormone to show up in the urine to indicate one is pregnant. Family, I'd like to move on to ovulation. Ovulation is when your ovaries release an egg for fertilization. Tiny finger-like structures called Embryo helps guide the egg through your fallopian tubes towards your uterus. During this journey, your fallopian tubes and egg can be fertilized by sperm. Moving on to conception. Conception happens when sperm swims up through the vagina and fertilizes an egg in the fallopian tube. It happens in the hours or days during your follicle phase. After conception, the fertilized egg implants into the uterus and a pregnancy begins. Family, this goes straight back to the menstrual cycle where the event occurs within your structure as it prepares for the possibility of pregnancy each month. Okay, I like to go on with the sperm now. Sperm production begins in the testicles. During ejaculation, millions of sperm cells are set free with the sole purpose of finding an egg to fertilize. Sperm cells swim up through the vagina and into your fallopian tubes. Millions of sperm battle to reach and penetrate the egg, but only one breaks through the egg's outer layer to fertilize it. Fertilization. A week after the sperm has fertilized the egg, the zygote has traveled to your uterus. It is now a growing cluster of about 100 cells called blitocysts. The blitocyst attaches itself to the lining of your uterus, the endometrium. This attachment procedure is called implantation. So, implantation, when implantation happens, the cell divide. Some cells develop into the baby and other cells form the placenta. The placenta is connected to the fetus by the umbilical cord. The umbilical cord is the lifeline to the baby, supplying nutrients. It is also known as the navel string. The umbilical cord normally contains two umbilical arteries and one umbilical vein. This is buried within a wharton jelly. The umbilical vein supplies the fetus with oxygenated, nutrients-rich blood from the placenta. The fetal heart pumps low oxygen, nutrients depleted blood through the umbilical arteries back to the placenta. Hormones are released to signal the structure a baby is growing inside your uterus. The hormones also signals the uterus to maintain its lining rather than shed it, which means you won't get your menstrual period, which means the first sign of pregnancy. So family, you don't know, we're going on to pregnancy. Pregnancy is a term to describe the period in which a fetus develops inside a woman's uterus or womb. It normally lasts about 40 weeks or just over 9 months. When measured from the last menstrual period to delivery is approximately 266 days to 270 days. Family, a pregnancy is divided into 3 stages called trimesters. A trimester lasts between 12 and 14 weeks. So, we're going on and read the trimesters. Okay, so the first trimester is conception to 12 weeks. During this period, your baby's body structure and organs develop. The heart begins beating during week 5. The brain, spinal cord, and other organs are beginning to form. At the 8th week, the developing baby is called a fetus. Your structure will also undergo major changes and you may feel nausea, fatigue, breast tenderness, and frequent urination. These are all common symptoms, but everyone has her own unique experiences. Okay? So the second trimester is 12 to 24 weeks. The unpleasant symptoms of early pregnancy subsides. You're likely to have increased energy and sleep better. An ultrasound can determine the gender of the baby early as 14 weeks. Between 16 and 20 weeks, you may feel the baby's first movement. This is known as quickening. Family, the third trimester. You are now nearing the home stretch of your pregnancy and are probably feeling very excited and anxious for the birth of your baby. Your baby bones are formed. Its touch receptors will be fully developed and the baby organs are capable of functioning on their own. As you near your due date, the baby structure may turn southwards into a head down position for birth. Family, give thanks for life and the mighty life giver that giveth life to all flesh. Holy Marcus, all Emmanuel, Selassie, Jah, Rastafari, and Empress Queen Omega, Selassie, Jah, Rastafari. Family, give thanks to the moment. It was a joy and a pleasure to bring the program, all the organs so far to the eye and them. And I want to give much thanks to the Honorable Jah Daniel and his network, the African Liberation League. I want to give thanks to the Honorable Empress Maisie and Jah Merciful Power, knowing heart and mind, that we could have come together, her royal daughters and sons, to bring forth heart and mind. Holy Marcus, all Emmanuel, Selassie, Jah, Rastafari. And last and not least, I would like to thank the royal viewers. our 200 plus, give thanks, give thanks, give thanks. So we know as long as it's one and it's more than 200, we know at least we know reach some hearts and minds. So with the health, I hope it was healthy, you're healthy, and with all the strength, you're strengthful, and with the restoration, your mind was restored within the power of the Holy Trinity. So give thanks, royal family, and a blessed night. Holy Marcus, Holy Manuel, Selassie Aisha, Rastafari. I would like to hand over the floor to my honorable sister, Honorable Simi, Ja Rastafari. Honorable Empress Simi.
Give thanks, Honorable Empress Rachel, for such pertinent and rich information about the conception of life, which is very important to all of us. So give thanks for all of that wonderful, knowledgeable information. I am Empress Cindy, and I will be discussing several issues related to pregnancy. So give thanks for the royal viewers that are listening to us on YouTube, and give thanks to the African Liberation Network, and give thanks to my sisters in Christ, Empress Miriam, Empress Rachel, Empress Dion, and Honorable Jack Lockie. So here we go. Pregnancy complications include physical and mental conditions that affect the health of the pregnant or postpartum woman, their baby, or both. Physical and mental conditions can lead to complications may start before, during, or after pregnancy. It's very important for women who may become pregnant to get health care before, during, and after pregnancy to lower the risk of pregnancy complications. If you are pregnant or gave birth within the last year, talk to your healthcare provider about anything that doesn't feel right. If you have an urgent maternal warning sign during or after pregnancy, please seek medical care immediately. Reducing your risk of pregnancy complications. Living a healthy lifestyle and getting health care before, during, and after pregnancy can lower your risk of pregnancy complications. Before you get pregnant, eat healthy, stay at a healthy weight, take care of your mental health, avoid tobacco products, and limit and or avoid alcohol. Preconception health care can also help you be as healthy as possible before you become pregnant. Once you're pregnant, start prenatal care early and talk to your healthcare provider about health conditions you have now or have had in the past. If you are being treated for a health condition or taking certain medications, your provider might recommend changing the way your health condition is managed. Be sure to also discuss problems you had in any previous pregnancies. After pregnancy, see your healthcare provider for postpartum care. Be sure to discuss anything that doesn't feel right, including not just physical symptoms, but also feelings of sadness, anxiety, and exhaustion that make it hard to care for yourself, your baby, or others. So I have a number of common complications that occur during pregnancy. The first one is anemia. Anemia is having lower than the normal number of healthy red blood cells. People with anemia may feel tired and weak. You are more likely to get iron deficiency anemia during pregnancy because your structure needs more iron than normal. Your healthcare provider will check your number of red blood cells during your pregnancy. Treating the underlying cause of the anemia, if possible, can help restore the number of healthy red blood cells. Number 2, anxiety. Anxiety disorders are common before, during, and after pregnancy. If you have an anxiety disorder, you may struggle with uncontrollable feelings of anxiety, nervousness, fear, worry, and or panic. These feelings can be intense and may last a long time. They can also interfere with relationships and daily activities such as work or school. Anxiety disorders often occur with depression. Getting treatment for anxiety before, during, and after pregnancy is important. Please talk to your healthcare provider as soon as possible if you think you have an anxiety disorder. Number 3 is depression. Everyone feels sad sometimes, but these feelings usually pass in a few days. Depression interferes with daily life and may last for weeks or months at a time. Some people have depression before, during, or after pregnancy. Symptoms of depression include lasting sad, anxious, or empty mood, feelings of hopelessness or pessimism, loss of energy, trouble resting or resting too much, overeating or loss of appetite, feelings of irritability or restlessness, problems concentrating, recalling details, and making decisions, feelings of guilt, worthlessness, or helplessness, suicidal thoughts or suicidal attempts. If you have many of these symptoms together and they last more than 2 weeks, you may have depression. Depression during pregnancy can make it hard for you to care for yourself and your pregnancy. Having depression before or during pregnancy is also a risk factor for postpartum depression, which is depression that occurs after pregnancy. Getting treatment is important for both mother and baby. Number 4 is diabetes. Diabetes is a disease that affects how your body and/or structure turns food into energy. There are 3 main types of diabetes: type 1, type 2, and gestational diabetes. For pregnant women with type 1 or type 2 diabetes, high blood sugar around the time of conception increases the risk of birth defects, stillbirth, and preterm birth. Among women with any type of diabetes, high blood sugar throughout pregnancy can also increase the risk of preeclampsia, cesarean delivery, and the baby being born too large. To manage your diabetes, see your doctor as recommended. Monitor your blood sugar levels. Follow a good nutrition plan developed with your provider or dietitian. Be physically active and take insulin if directed. Managing diabetes can help you have a healthy pregnancy. If you have diabetes before pregnancy or develop it during pregnancy, it's important to continue seeing your healthcare provider after pregnancy to monitor your blood sugar and overall health. Number 5, we have heart conditions such as coronary artery disease, heart attack, cardiomyopathy, and congenital heart defects impact the heart and blood vessels. Making healthy food choices, limiting your alcohol intake, quitting smoking if you smoke, and managing any other chronic conditions can help reduce your risk of many heart conditions. Not everyone has symptoms, but you may feel neck, jaw, chest, belly, or back pain if you have a heart condition. Many women with heart conditions have healthy, uneventful pregnancies, but pregnancies can put stress on the heart of women with some types of heart conditions. Having a heart condition may increase the risk of severe illness and death during and after pregnancy. Number 6 is high blood pressure, also known as hypertension. High blood pressure is a common heart condition occurring when your blood pressure is higher than normal. Chronic hypertension means having high blood pressure before you get pregnant or before 20 weeks of pregnancy. Gestational hypertension is high blood pressure that occurs after 20 weeks of pregnancy. Preeclampsia happens if you previously had normal blood pressure and suddenly develop high blood pressure and protein in your urine or other problems after 20 weeks of pregnancy. If you have chronic hypertension, you can also get preeclampsia. High blood pressure increases the risk of preterm delivery and low birth weight, plus more serious issues such as eclampsia, stroke, placental abruption, meaning the placenta separating from the wall of the uterus. High blood pressure may be prevented and is treatable. Number 7 is hyperemesis gravidarum. Many pregnant women have some nausea or vomiting or morning sickness, especially in the first 3 months of pregnancy. Hyperemesis gravidarum, however, is more extreme than morning sickness. It refers to persistent nausea and vomiting during pregnancy. This can lead to weight loss and dehydration and may require intensive treatment. Number 8 is infections. Infections can complicate pregnancy and may have serious consequences. Being screened and treated for infections such as HIV and other sexually transmitted infections and getting recommended treatment. Easy steps including hand washing and avoiding certain foods can also protect you from some infections. One common bacterial infection during pregnancy is urinary tract infection. Your healthcare provider will likely test your urine early in the pregnancy to see if you have a UTI and treat you with antibiotics if necessary. Treatment will make it better often within 1 or 2 days. Number 9 is weight gain. Starting pregnancy at a healthy weight can help reduce the risk of preeclampsia, gestational diabetes, and stillbirth, and cesarean delivery. If you are underweight or overweight, talk to your healthcare provider about ways to reach and maintain a healthy weight before you get pregnant. Gaining a healthy amount of weight during pregnancy is also important for your health during and after pregnancy. Number 10 is amniotic fluid complications. Too much or too little amniotic fluid in the sac around the fetus may be a sign of a problem with the pregnancy. Too much fluid can put too much pressure on the mother's uterus, leading to preterm labor. It can also cause pressure on the mother's diaphragm. This can lead to breathing difficulties. Fluids tend to build up in cases of uncontrolled diabetes, and multiple pregnancy, incompatible blood types, or birth defects. Too little fluid may be a sign of birth defects, growth retardation, or stillbirth. Number 11 is ectopic pregnancy. An ectopic pregnancy is the development of the fetus outside of the uterus. This can happen in the fallopian tubes, cervical canal, or the pelvic or belly. The cause of an ectopic pregnancy is usually scar tissue in the fallopian tube from infection or from infection or disease. The risk of ectopic pregnancy is increased in women who have tubal sterilization procedures, especially women who were younger than the age of 30 at the time of sterilization. Number 12 is miscarriage or fetal loss. A miscarriage is a pregnancy loss that happens up to 20 weeks of gestation. Most miscarriages happen before 12 weeks. Miscarriages happen in about 15% of all pregnancies and are usually due to genetic or chromosomal abnormalities. Miscarriages are usually preceded by spotting and intense cramping. To confirm a miscarriage, an ultrasound and blood test may be done. The fetus and contents of the uterus are often naturally expelled. Fetal loss in the second trimester may happen if the cervix is weak and opens too early. This is called incompetent cervix. In some cases of an incompetent cervix, a healthcare provider can help prevent pregnancy loss by stitching the cervix closed until delivery. Number 13 is placental complications. Under normal circumstances, the placenta attaches to the uterine wall. However, two types of placental complications may happen, including placental abruption. Sometimes the placenta becomes detached from the uterine wall too soon. This is called placental abruption and leads to bleeding and less oxygen and nutrients to the fetus. The detachment may be complete or partial. The cause of placental abruption is often unknown. Placental abruption happens in about 1 in every 100 live births. Number 14, placenta previa. Normally, the placenta is located in the upper part of the uterus. Placenta previa is a condition in which the placenta is attached close to or covering the cervix. This type of placental complication happens in about 1 in every 200 deliveries and happens more often in women who have scarring of the uterus from previous pregnancies. It also happens in women who have fibroids or other problems in the uterus, or in women who have had previous uterine surgeries. Symptoms may include vaginal bleeding that is bright red and not associated with belly tenderness or pain. Diagnosis is confirmed by doing a physical exam and an ultrasound. Depending on how bad the problem is, the stage of pregnancy, a change in activities or bed rest may be ordered. The baby usually has to be delivered by cesarean section to keep the placenta from detaching early and depriving the baby of oxygen during delivery. Okay. Further, ladies, my Lord and Empress, I would like to further elaborate on signs and symptoms of preeclampsia. Preeclampsia is a serious condition that can happen after the 20th week of pregnancy or after giving birth, called postpartum preeclampsia. What are the signs and symptoms of preeclampsia? High blood pressure with or without protein in the urine. Changes in vision like blurriness, flashing lights, seeing spots, or being sensitive to light. Headaches that don't go away. Nausea, feeling sick to your stomach, vomiting, or dizziness. Pain in the upper right belly area or in the shoulder. Sudden weight gain, 2 to 5 pounds in a week. Swelling in the legs, hands, or face, and trouble breathing. Many of these signs and symptoms are common discomforts of pregnancy. If you have one sign or symptom, call your provider right away. Sometimes you don't realize you have preeclampsia. Go to all your prenatal visits, even if you feel fine. That's the best way to detect preeclampsia. Are you at risk for preeclampsia? You're at high risk for preeclampsia if you've had preeclampsia in a previous pregnancy. The earlier in pregnancy you had preeclampsia, the higher your risk is to have it again. You're also at a higher risk if you had preeclampsia along with other pregnancy complications. You're pregnant with multiples, twins, triplets, or more. You have high blood pressure or diabetes, kidney disease, or an autoimmune disease like lupus or antiphospholipid syndrome. Diabetes is when your body has too much sugar in the blood. This can damage organs like blood vessels, nerves, eyes, and kidneys. Moving on. I would like to focus now on racial disparities in healthcare when it comes to pregnant women. Black women are 3 times more likely to die from a pregnancy-related cause than white women. Multiple factors contribute to these disparities, such as variation in quality health care, underlying chronic conditions, structural racism, and implicit bias. Social determinants of health prevent many women from racial and ethnic groups from having fair opportunities for economic, physical, and emotional health. Each year in the United States, hundreds of women die during pregnancy or in the year after. Thousands more have unexpected outcomes of labor and delivery with serious short or long-term health consequences. Every pregnancy-related death is tragic, especially because more than 80% of pregnancy-related deaths in the US are preventable. Recognizing urgent maternal warning signs, providing timely treatment, and delivering respectful quality care can prevent many pregnancy-related deaths. In a study done in 2021, the maternal mortality rate for non-Hispanic Black women was 69.9 deaths per 1,000 live births, 2.6 times the rate for non-Hispanic white. Rates for Black women were significantly higher than the rates for white and Hispanic women. The increases from 2020 to 2021 for all race and Hispanic origin groups were significant. Moving on, I would like to also let the viewers know that when it comes to maternal mortality, Black women are hit the hardest as maternal death in the US soars. The number of women who die within a year after pregnancy more than doubled between 1999 and 2019 in the United States. A study has found that the highest number of deaths recorded among Black women. Overall, the number of deaths per 100,000 live births rose from 12.7 to 32.2 in a 20-year span, while the number of deaths among Black women increased from 26.7 to 55.4. The greatest jump over time has been seen amongst American Indian and Alaskan Native women. Among wealthy nations, the US has one of the highest rates of maternal mortality, which is defined as a death during pregnancy or up to a year afterwards. And now, my Lord and Empress, I would like to shed some light on an Olympic athlete who recently passed away by the name of Tori Bowie. She was one of the fastest women in the world. Miss Bowie's career highlights include a 100-meter world championship and 3 Olympic medals, and one of them was gold. On May 2nd, she was found deceased, and she was just 32 years old. Ms. Bowie was 8 months pregnant and died due to complications from childbirth. The autopsy reports that she that Ms. Bowie passed away from complications of respiratory distress and eclampsia. Ms. Bowie's death highlights risk among amongst Black people in America, in which Black women face an elevated risk of preeclampsia and eclampsia. And I say all that to say that midwives in many countries are, they're key providers to, they're trained and they're key providers to, pregnant women. And when a woman seeks midwifery-led care, they have better outcomes. There's more of a positive outcome than, seeing an OBGYN and giving birth in hospitals. So, my Lord and Empress, that's my presentation. Give thanks to the African Liberation Network and give thanks to Honorable Empress Miriam, Honorable Empress Rachel, and Honorable Empress Jack Clarkey. And I would like to hand over the floor to the Honorable Empress Dion. Give thanks.
Blessed love, my Lord and Empress. Give thanks. Give thanks, Empress Cindy, Empress Rachel, and Empress Macy for that wonderful presentation, and Empress Macy for that wonderful hymn. My name is Empress Dion, and I will be talking about the foods and herbs from healthy pregnancy to mother and child. Holy Emmanuel I, Selassie I, Jah, Rastafari. The mother should have plenty of rest, fresh air, and moderate exercise, seeing as pregnancy to delivery is a muscular action taking place. So a little yoga or dance or even light walking could help, A simple, non-stimulating diet is necessary if you would have a happy, healthy child. Meats of all kinds should be eaten very sparingly, if at all, please. Special attention must be given to the bowels. They should move every day, and I will give you foods to assist shortly. Breastfeeding. Breastfeeding is the best method for healthy mothers who have full-term babies. There are three main advantages: nutritional, psychological, and immunological. There is also an economical advantage, and no time is needed for the preparation of formulas. So the best milk is breast milk. The babies come in with their own food, so you don't have to spend no money to buy no food for them. It's the best. Breastfeeding is clean, and contamination of any kind is infrequent. Breastfeeding also offers some degree of protection against pregnancy. It should not be relied on as a completely safe means of contraception during this time. The nutrient content of breast milk is especially suited for infants. It produces a small curd in the infant's stomach that can easily be digested. The total protein content is much lower than cow's milk, so less nitrogen has to be removed by the infant's immature kidneys and liver. The amount and type of protein in human milk are ideal for the infant's growth and is unlikely to cause any type of allergic reaction. The relatively large amount of cholesterol in human milk is needed for proper development of the nervous system and for the manufacture of steroid hormones and bile acids. Human milk contains slightly more carbohydrate than cow's milk. Breast milk contains immunoglobulins, lactoferrin, and bifidus factors that protect the infant from many diseases such as tetanus, whooping cough, diphtheria, shingella, salmonella, infantile paralysis, and other bacterial and viral diseases. There is also a great psychological benefit for both mother and child. The child develops a sense of trust and closeness to the mother, and the mother is offered an excellent opportunity to develop a stable, affectionate relationship with her child. In order to get the most benefit from breast milk, it should be the main source of food for the infant for the first 4 to 6 months of life. Despite the fact that many are advocating feeding solids as early as 1 to 2 months. This gives the child the best protection against disease since the infant's own immunological defense system is not developed totally for 9 to 12 months of age. It also reduces the risk of introducing foreign proteins, which may cause an allergic reaction in the infants. Now, we don't see cows giving the calves human milk, so it is unadvisable to give your babies cow's milk. But if you should seek an option for, if it is not possible to satisfy the infant totally using the mother's milk, some type of formula may have to be added as a supplement. The mother should continue nursing as long as possible. However, since the infant will receive benefit from any human milk it can get, fresh cow's milk should never be used before the age of 12 months. When the diet of the mother is nutritionally adequate, the breast milk will meet all the growth requirements of the infant, except for vitamin D, iron, and fluoride. A vitamin supplement of 400 IU a day of vitamin D should be started at birth. Vitamin D is necessary for the absorption of calcium and phosphorus, which are two minerals most important in the formation of bones. In order to prevent an iron deficiency anemia in the infant, an iron supplement should be started at 4 to 6 months of age. Since at about this time, the infant's store of iron is used up. Never give more than 50 milligrams of iron a day. I actually use IFA for my daughters, so you can find out from your pediatrician to see what best suits your child. Dress. The wearing of tight clothing by the mother-to-be is extremely detrimental to the child, and such garments should not be worn. The dress should be loose and suitable for the different seasons. When the abdomen becomes greatly enlarged, it will be found beneficial and comfortable to wear a wide band to support the abdomen, but do not have it tight. Tight clothing should not be worn around the breasts. Baths. Frequent sitz baths will relieve many of the local ailments that women suffer during this period. They should be taken at least 2 or 3 times a week. During the last weeks of pregnancy, they should be taken daily. A full bath should be taken daily to keep the skin and circulation in good condition. Mental attitude. If you want a cheerful, happy child with a sunny disposition, that is how you will have to be during your pregnancy. Special effort should be made by the mother to avoid as much unpleasantness as possible. A fit of anger, great fight may have a bad effect on the child. The surroundings should be made as pleasant as possible. And it is positively the husband's duty to bring about this as far as lies in his power. By proper living care and treatment, pain can be entirely banished at childbirth. Jah Rastafari. I will be coming with foods now. 10 foods for a healthy pregnancy. 1. Algae oil. You have likely heard before the omega-3 DHA is vital to the formation of your baby's eyes, brain, and nervous system. Traditionally, dietitians recommend fish as the best source of DHA. However, algae oil is a plant-based source of DHA among omega-3s. To eat the algae oil is to go directly to the source. Research shows that it increases blood DHA, the same as fish oil, but it has the benefits of not contributing to overfishing, global warming, and destroying our coral reefs. It is lower in mercury and toxins than fish and also has a neutral flavor. However, if you can't get algae oil, there is fish like salmon, sardines, mackerels, and herrings, which have low levels of mercury and harmful minerals, but contains high levels of omega-3 fatty acids. 2. Dark leafy greens. Spinach, Swiss chard, kale, and collard greens are terrific sources of fiber, calcium, iron, vitamin A, C, K, and folic acid, as well as necessary vitamins. They help with the formation of baby's tissues, build a healthy blood supply, and bone growth. They also protect your baby's DNA from methylation changes. High folate help neural tube development, protecting against neural tube defects. And vitamin K helps to reduce the risk of postpartum hemorrhage. Eating vegetables with a fat source, such as oil, butter, ghee, avocado, helps the absorption of fat-soluble vitamins such as A, D, E, and K. Iron is important to carry oxygen to your growing baby, and it also encourages the development of the baby's red blood cells. 3. Carrots. Pregnant women need vitamin A because it helps the development of the skin, eyes, teeth, and bones for your baby. You don't want to skip out on vitamin A, and carrots are a fantastic source. Also, a high fiber content, which keeps your bowels moving, reducing constipation. Another rich source of vitamin A is sweet potato. 4. Bananas. A pregnancy superfood that's also easy to eat on the go. Bananas have high levels of potassium, which fights off that terrible pregnancy fatigue that drains your structure by midday. Eat them plain or add them to your yogurt or cereal. 5. Eggs. Eggs are an excellent source of protein and are one of the best sources of choline. Choline is important for development of the memory center of the brain and neural tube formation. One study found that 54% of pregnant women had a choline deficiency. Now, like me, if you don't eat eggs, ask your healthcare provider about a choline supplement. Avocados are especially rich in the carotenoid lutein. Lutein has powerful antioxidant properties and is important for your baby's eye development and brain. brain function. They also contain glutamine, as well as vitamin C, vitamin E, and vitamin K, which act as an antioxidant and anti-inflammatory to protect the liver. Avocados are also high in folate, magnesium, and potassium. Getting enough potassium may help regulate blood pressure during pregnancy. Another fun reason to eat avocados. Berries. Blackberries, raspberries, strawberries, and blueberries are high in vitamin C and antioxidants, fiber, potassium, and folate. Vitamin C helps the structure absorbs iron, which helps carry oxygen to your baby. 8. Nuts and seeds. A healthy yet convenient snack. All nuts contain magnesium, iron, copper, selenium, zinc, and fiber. Walnuts, almonds, and pistachios include omega-3 fatty acids, which are valuable for your baby's development. The fiber in nuts and seeds are also helpful in the aid of digestion. The healthy fats aid in neurological and brain development of the baby. 9. Chia seeds. These are rich in calcium, magnesium, iron, fiber, and potassium. They have the ideal balance of soluble to insoluble fiber to help regulate bowel movement and maintain healthy gut bacterial levels. And last, and certainly not the least, okra or okra. Studies show that from ovulation to high blood pressure, okra is excellent. It is high in folic acid and helps with the growth of the fetus in the womb, where chances of neural tube disorder is greatly reduced. Folic acid is also important for the baby's muscles and bone development. It also has antioxidants that keep your baby detoxified from free radicals that can hamper with tissue development and DNA development of the baby. Vitamin C, fiber with amino acids, tryptophan, vitamin A, and beta carotene. So in your last trimester, every day for at least 21 days, the consumption of okra is excellent. And now, my beloved family, herbs. Vervine and dill herb tea is excellent to increase milk after conception. The more water you drink, the more milk you will produce. For the contracting of the uterine muscles, parsley juice, stinging nettle, vervain, blue vervain, about 2 teaspoons of the dry herbs to 1 cup of hot water. Let steep and drink once a day. 1 time a day is sufficient. Spikenard is an old Indian remedy to promote easy and painless childbirth. For bleeding after childbirth, there is a hot tea for douching made of wild almond root and wild oak bark. Periwinkle tea is also an excellent astringent. Red raspberry should be used after childbirth to help build iron. I would like to add that this program is for educational purposes and we are not professional doctors or herbalists. Please seek professional advice before medicating yourself or your child. So to my YouTube family, stay happy, healthy, and beautiful. I would like to pass the floor to Honorable Jack Clarkey, my Lord. Blessed love, give thanks.
Blessed love to your family. Just for a short moment, the Empress Cindy wanted to say something, so freedom of the Empress.
Give thanks, my Lord. Two more things that I wanted to add to my presentation are maternal deaths by country. And a study done in 2017, the 5 countries with the highest number of maternal deaths were Nigeria at 67,000, India with 35,000, the Democratic Republic of Congo with 16,000, Ethiopia at 14,000, and Tanzania at 11,000. Mortality risk per pregnancy. In most high-income countries, maternal mortality is now very low. The average rate in the European Union is 8 maternal deaths per 100,000 live births. In some countries such as Poland, Italy, and Sweden, the rate is even lower at 3 to 4 per 100,000. In Sierra Leone, a woman is 300 to 400 times more likely to die with each pregnancy, at an estimated rate of 1,120 deaths per 100,000 live births. Around 1 in 80 pregnancies ends in the passing of the mother. The 5 countries where a woman is most likely to pass away in a given pregnancy are 5. The number 1 is South Sudan. Number 2 is Chad. Number 3 is Sierra Leone. Number 4 is Nigeria. And number 5, Somalia. Holy Emmanuel I, King Selassie I, Empress Menen I, John Marcus I, Selassie I, Jah Rastafari. Give thanks, my Lord. And I'm passing it over to the Honorable Jack Clarkey. Give thanks once again.
Oh, give thanks to the royal goddess. Yes, give thanks to the African Liberation Network, host Honorable Jah Daniel. And I give thanks to the Royal Empress Maisie. Give thanks to be part of this royal family here, you know. And to know everything was said and done at this moment. So, royal viewers, you know, give thanks for the time to listen to us again once. You know, we love that the I&M show. I&I, because without I&I, you know, and his support, you know, to keep us going to do this work, you know. Give thanks to the love. So this is my part of this segment here, you know, to do this scriptical part. So I bring forth now, at this time, from conception to birth. The Marcus I, the Emmanuel I, Selassie I, Jah Rastafari. It's the royal family. Give thanks. So we go into the book of St. Luke, chapter 1. Now, before I go into this book, I would just like to say that within the testimonies from Matthew, Mark, Luke, and John, St. Luke is the only book where actually show you the months of pregnancy, you know. And he bringing forth at John, the Honorable, and Justus, you know, the Christ man. So I just want to bring forth such understanding. According to the Empresses and them, from Empress Royal, Empress Risha, to Empress Cindy, to Empress Dion, you know, with the combination, you want to bring forth something to enlighten the viewers. So I read from the good book of St. Luke, chapter 1. Most High, Selassie, Jah Rastafari. Now this is John Father, right, by the name of Zachariah. So in the book, of St. Luke chapter 1, verse 5. Continue and read it. There was in the days of Herod, the king of Judea, a certain priest named Zacharias of the course of Abia, and his wife was of the daughters of Aaron, and her name was Elizabeth. And they were both righteous before God, walking in all the commandments and ordinances of the Lord, blameless. And they had no child, because that Elizabeth was barren. And they both were now well stricken in years. And it came to pass that while he, which is Zacharias, John's father, executed the priest's office before God in the order of his course, according to the customs of the priest's office, his lot was to burn incense when he went into the temple of the Lord. And the whole multitude of the people were praying without at the time of incense. And there appeared unto him an angel, which is Zacharias, of the Lord, standing on the right side of the altar of incense. And when Zacharias saw him, he was troubled, and fear fell upon him. Now, this is according to the scripture testimony, right? But the angel said unto him, Fear not, Zacharias, for thy prayer is heard. And thy wife, Elizabeth, shall bear thee a son, and thou shalt call his name John, Marcus, I, Celestia, Jah, Rastafari. So we see now, hold on for a moment. So we see now the father of John was a priest. His mother was from the lineage of Aaron, which was of the daughters of Aaron. So we see now the two connections to bring forth such man, right? Which is even in the meditation, right? The conceptive part. You know, man coming with woman to be one to bring forth. So we see like this man here now, Zacharias, we could say like he was purifying himself. To purifying himself now to bring forth this man, which is John now. We see personally now, you understand me, that how it rests now. You understand me? Concerning this man. No, continue on reading. Continue on reading. Right? Continue on reading here. In verse 12. And when Zacharias saw him, he was troubled. And fear fell upon him. But the angel said unto him, Fear not, Zacharias, for thy prayer is heard, and thy wife, Elizabeth, shall bear thee a son, and thou shalt call his name John. And thou shalt have joy and gladness, and many shall rejoice at his birth. For he shall be great in the sight of the Lord, and shall drink neither wine nor strong drink, and he shall be filled with the Holy Spirit, even from his mother womb, which is the word embedded in him. So we see now, through John now, taking this order here from even in his state of being conceiving, right? The angel show him, well, no strong drink, no wine. You understand me? That is how we have to, dwell with it. As one who coming forth out of the womb. And many of the children of Israel in verse 16 shall return to the Lord their God. So we see this man now, John, preparing now to come forth. Now, hold on, family. Right? We're going to continue and read here now. Right? As Zacharias now, in verse 21, right? We will read. And the people waited for Zacharias and marveled that he tarried so long in the temple. Now, why I read from here today is just showing you, right, that what taking place now, within the movements of the birth of John. And when he came out, he could not speak unto them. And they perceived that he had seen a vision in the temple. For he beckoned unto them and remained speechless. So he come like he just hold the meditation according to the word of the angel still. And it came to pass that as soon as the days of his ministration were accomplished, he departed to his own house. So we see now after now he minister within the temple now, he coming home them to his wife now. Yeah, he ministry done. So he hear him back home. And after those days, his wife, Elizabeth, conceived and hid herself 5 months, saying, thus had the Lord dwelt with me in the days wherein he looked on me to take away my reproach among men. So give thanks now, we see it now, even now in the scriptural way, the conception of John. The scriptural know that it was about 5 months, right? Now, that coming into the first prime minister, into the second prime minister, as you all reasoned before. Which the first prime minister is 12 weeks, as we see, which is like 3 months. And then we see second prime minister is 24 weeks from the 12 to that coming year. So we see now with 24 and 4, if we divide the months equally, 7 days by 4 weeks, we will get 26. From the 5, it will be 20. Right? From the 4, we will get 24. Right, my Lord, which is the 6th month. 6 4s are 24. So we see the Prime Minister working, right, going through, right, within John coming forward. In verse 26, in the 6th month, the angel Gabriel was sent from God unto a city of Galilee named Nazareth. Now take note, we don't see John's mother within 5 months to 6 months, right? To a virgin espoused to a man whose name was Joseph of the house of David, and the virgin name was Mary. So we see here now that Christ coming forward here now, right, within this manifestation, but we're dealing with the time. Still, we're not straying from the point. We're dealing with the time of John coming forward. So it's about the 6 month now. Such message now come now to, as we say, a virgin, right? To a man whose name was Joseph of the house of David, and the virgin name was Mary. Okay, right? Now the same said angel now. We see now, because angel come now and reason to Zacharias, right? As we see according to the scriptures in the temple, and tell him, watch, they're going to get somewhere to hold a meditation, because he and all was in a state, and he come back and see the angel work fulfill just natural, which is the presence of God in our man, Now to the way looking, inwardly we dealing with reality, So we see it now. Continue and reading in the same chapter in the book of St. Luke now. In verse 36. Right? After now we come back and see the angel now come back and reason with Joseph and Mary and all these different things coming on in the chapters. We see now in verse 36 now. Continue and reading. And behold, thy cousin right, Elizabeth, she had also conceived a son in her old age. And this is the 6th month with her who was called barren. So we see now that Mary and John mother is cousin, according to the scriptures. So we see in the lineage, we see in the royalty moving, right? We see in the connection. So she and now come and confirm now, right? It is the 6th month where Mary now come and check Elizabeth and there was dwelling, right? Who was called barren. Now, if we continue and read in the same said chapter, right? In verse 39, yes, from the same said chapter in St. Luke. Take note, just linking line per line. And Mary now arose in those days and went into the hill country with haste into a city of Judah and entered into the house of Zacharias and saluted John mother. Right? No, she entered into the house of Zacharias in that same set time, the 6th month, right? And saluted she cousin. And it came to pass in verse 41 that when Elizabeth heard the salutation of Mary, the babe leaped in her womb. And Elizabeth was filled with the Holy Spirit. So she started reason, Mary, you didn't see what go on? Soon as I come now and you bless me up and thing, I feel John, I feel the connection, yeah, Chad, give thanks, because the see is a certain humility taking place, as the scripture say, she salutes her, which is a blessed love, heart of love, royalty. So we see it now, the manifestation now, and the baby going through the 6th month flowing, which is the second trimester flowing, coming down to the last trimester, which is 3 months after. Take note. So you see now, and she spake in verse 42, out with a loud voice and said, Blessed art thou among women, and blessed is the fruit of thy womb. So you see where the blessings is word, song, and power. Bless back up and say, Yes, I. And whence is this to me that the mother of my Lord shall come to me? For lo, as soon as the voice of the salutation sounded in my ears, the babe leaped in my womb for joy. So she and all over's nurtured. Connection again. We're talking now about the umbilical cord. We're talking about the energy of our youth. You understand me? The connection of food, the connection of thought from the mother now. Here in that salutation and that peace and that joyful flow now. We see now the babe now reacting, which is John. Now John now meeting now. You understand me? He, mother, cousin. So he's like the family. Which now, Mary now, bringing forth justice within. Now we're going and stay focused. We going to see all this now revealing here. Right? Now when we continue and we read now, from verse 42. And she spake out with a loud voice and said, Blessed art thou among women, and blessed is the fruit of thy womb. Right? So we see after that blessing then, she remind her in verse 44, the salutation sound in she hears and the baby leap. And we see now, after now the baby leap now, in verse right, 56. From your read now, you just see within the other chapters, within the other verses now, just come back and show you the strength that he coming forth still at the generation and, all the works he had to do to fill the hungry and to bring good tidings and, right? But I just keeping it short and spicy. In verse 56, and Mary, continue on reading, and Mary abode with her about 3 months. So Mary abode with John mother about 3 months. Now remember the angel don't tell Mary she will not conceive, so Mary could have be about 3 months with Christ within that flow. You understand me? And Mary abode with her about 3 months and returned to her own house. Now, Elizabeth full time came that she should be delivered, and she brought forth a son. Holy John I, Selassie I, Jah, Rastafari. So we see family evidently the trimesters working from conception, show this baby have to come. You understand me? The priest was ministered. We see that he had to purify himself to bring forth a seed, my Lord. Right? We see now after that now, we see at this point in time how the whole 5 months to the 6th month, which is the first and the second trimester, and to the 3rd month, as noted in the scriptures, because Maria abode with her about 3 months. And she says she leave about 6 months, because the 6th month she departed to go to check John's mother. So 3 by 6 by 3 is 9 months. And we see Elizabeth was full time after she leave, which is married to go back in her own house. So we get down to the 9 months, clearly seen by John coming forward. Holy Marcus I, Holy Emmanuel I, Selassie I, Jah, Rastafari. Yeah, it's about a mighty man, you know, like Jeremiah the prophet, the same said John, which John sanctifying from the womb in the book of Jeremiah chapter 1. So give thanks to the moment, you know, love and light, you know, give thanks to your viewers. Thanks for strength and power, you know, give thanks to this moment, you know. And share with the eye and them and come to do this as a joy. And we can just hold our joy and teach each other and you know, reason one towards another about we goody. As I say, you know, sometimes we see things, you know, we hear things now, you know, but we never know how it is really working with structure. So give thanks to this moment, give thanks to the Honorable host of the African Liberation Network still, you know, Daniel and all the royal empresses, my lord, and the viewers. Yeah, this is Honorable Jack Clark. Holy Marcus I, Holy Emmanuel I, Selassie I, Jah, Rastafari. So I do hand over the
Turn
floor
over the foot to John Daniel.
to Jah Daniel. Blessed love.
Give thanks for life and the mighty life giver. Most High, King Selassie I, Jah, Rastafari. Yes, give thanks for everyone's presentations, you know. Everyone did a wonderful job, you know, as usual. I learned a lot while I was listening, you know, and it's just a great experience to see my sisters, my mother, my brother, all working together, you know, consistently, and bringing forth positive information and I can each one, you know, when it comes to public speaking, the presentation of the information and, you know, putting it all together, each one of them, you know, from the first episode until now has been constantly getting better at what they do. And I applaud, you know, the Health, Strength, and Restoration group for their efforts and for, you know, just being consistent and persistent. And, you know, I hope and pray that you continue on the same path of progress and, you know, collective work and responsibility. And, you know, that this program continues to help, you know, the researchers as well as those watching, because, you know, the human structure is a lot of systems, a lot of organs, you know, a whole lot of information. So, you know, there's a lot more to cover. So I you know, pray that, you know, Jah will strengthen the item and keep you together, keep you focused, and, you know, continue to bring forth the good information, you know, to help ones and ones to know themselves, you know, so we can be healthy, you know, because being healthy and living healthy, eating right, understanding how the goodie works, what foods to eat, what not to eat, what herbs to use, can really keep us out of the hospitals, you know, and keep us more in tune with ourselves and make us value, you know, more the things that we eat and the way that we live, you know, our lifestyle. And so understanding these things really is vital to every individual, you know. So it's just for ones and ones to really take the information and use it. So yeah, give thanks again, my Lord and Empress, for your work and your dedication, livocation, you know, and the effort, you know, and that you put into it, and yeah, the thought and everything that goes into making this program what it is. And you know, especially give thanks to the Honorable Empress Maisie for really, you know, bringing all of us together, really, you know. Um, I have met, you know, Empress Cindy and Priest Germain before the formation of the African Liberation Network, but the brethren and sistren in, you know, Trinidad and other places that kind of have come to the African Liberation Network through Empress Maisie, has been, you know, the majority of the people that have worked with us have been through her, bringing them here, and also, you know, this whole project being orchestrated by her. You know, even though she may not be presenting the information, that's for the younger ones who, you know, have, you know, are able to do the research and all of that, but she definitely does her part to make sure that the program continues, and she gives her input, you know, and also she's such a for all of us, you know, her children. And we, you know, I would like to say on behalf of all of us that we appreciate you, and you know, we acknowledge what you do, and we value you and what you do, you know, for us as individuals, and for the group, and for the African Liberation Network, and for the Ethiopia Africa Black International Congress, and for the Women's Freedom Liberation League, and for Black people in general, you know. Glorify and give thanks for the Honorable Empress Miriam and her work over the year, you know. Yeah, longer than we, most of us maybe have been alive, probably. So yeah, give thanks, Mama Maisie. But yeah, that's my few words. Yes, you can go ahead. You can take the floor.
Give thanks, my Lord Honorable Prophet Daniel. It is an honor and a privilege, Majesty, you know, to be in such company with, you know, with the IDM, my brothers and sisters, and such a wonderful work, you know, that we have been doing over the years. You know, we give thanks, you know, for you know, the researchers, them, you know, to really put some quality time. You know, come members said they are wives and they have children, they have people work and thing, but somehow they find time, you know, they find time to do the research, you know, and I give thanks for them. Working with my younger sisters, them is a privilege, and my brothers, you know, and I'm glad they make me happy. They give me joy. We work together in love and unity. We are happy together. You know, we are love. We are just a, you know, a family of joy and love. And so I give thanks for all what's said and done here tonight and over the year. You know, as this season is coming to a close, you know, right now family will be not be heard for another few months. You know, we are taking some time off. You know, first season has been, you know, this is the end, the last program for this season. And so we are going to come forward, you know, with second season of health strength and restoration. I give thanks, you know, for the viewers. You know, I love the item. I give thanks for all, you know, that support I and I, you know, over the year, you know, and I thank God and hope that all will be well, you know, with my viewers. They will be taking care of themselves, you know, eating right, you know, you know, and take heed, you know, as they over the year we have been trying to help one another by you know, educating ourselves about our structure and how it works, and the food, the proper food that it need to function, each organs. So we'll be coming on in another few months, coming on strong and powerful, to my listeners. I do give thanks for Daniel of the African Liberation Network, and the honorable host, and give thanks each and every one, my family, thank God for for his skillful guidance and protection, as we do our work. Family, Sister Diana, I'll be turning over the floor, for the last moment within this program here. So I'll be handing over the floor for the item to say them little piece, closing the program, for this time. Until next time, family, out of love, out of joy, thank the listeners as we look forward to join forward the program, as it comes forward on stream. May God continue to bless, guide, and protect. Take care of yourself, God, no one not going to take care of you if you don't take care of yourself. Love yourself. All right. God bless you. Holy Manuel I, Selassie I, Jah, Rastafari. Over to Sister Diana and Sister Cindy for them final piece. Thanks.
Give thanks for that wonderful closing remarks from the Honorable Empress Miriam and the Honorable John Daniel. I'm Empress Cindy, and I wanted to say a few closing remarks. The program started about it started a year ago, and we've had, a lot of topics that we've covered, and ones and ones have, paid attention to us on YouTube, and we've gotten a tremendous amount of support. So I just wanted to give thanks once more to the Honorable Empress Miriam for, putting this health, strength, and restoration program together with myself. I also wanted to give thanks to Honorable Honorable Prophet Jah Daniel, for allowing us to, present and, give research to viewers who are interested in learning more about health topics and how ones and ones can cure themselves naturally. I also wanted to give thanks to my sistrins, Empress Rachel and Empress Dion, for always coming with it. They always have their stuff put together, and we work as a team. And as well as Honorable Jack Clarkey, he comes in with that spiritual aspect that really, ties it all together for us. So give thanks to the viewers once again for all your support throughout the year. We're going to be coming back with newer topics in the autumn season. So, be on the lookout for us once more. And I also wanted to say that it's fitting that we're ending the program in the month of July, where this is the month that His Imperial Majesty Haile Selassie I was born, a king born on the 23rd of July. So it's only fitting that, we end this program talking about conception and pregnancy, and then here we go, we're going to be celebrating the life of His Imperial Majesty, and it's a very huge celebration for I. So give thanks to all the listeners, give thanks to my sisters, give thanks to Mama Miriam, Jah Daniel, and you all take care for the rest of the summer, and we'll see you again in the autumn. Blessed love, my Lord and Empress.
Okay, 1 second here, family. We're giving thanks. I must especially give thanks to Honorable Empress Trisha, who was working with I, for a few months, by telling us about the juice, to strengthen back the goodies still. While working with us, you do a wonderful work, wonderful job. And I must say, we miss her not being with us, but we appreciate what she came on in the program and what she have done, and may God continue to bless her, guide her, and keep her through just strength and power. Love your sister Trish. And thanks again. Back over the floor to Sister Diane. Blessed love.
Blessed love.
Blessed love, my Lord and Empress, once again. I am Empress Dion, and I will be doing a poem based on the body parts or the structural parts or structural organs that we did thus far. Holy Emmanuel I, Selassie I, Rastafari. One structure, different companies. Head, shoulders, knees, and toes, eyes, ears, mouth is the body parts they taught us about. But there's a whole lot to shout out. Your thyroid is in your throat, but it is ready for growth. Your liver and lungs does transportation work. The pores, bladder, and anus work in waste management where fiber is employed by one and not all. Whilst your kidney and spleen manage the cleaning company in your body where the blood is the boss for that company. To show that the blood can't be beat, it runs from your head to your feet. Menopause is when women go up in stage, we get hot. Andropause or womanopause is when men go down a stage, they get what? And pregnancy and childbirth comes before womanopause and menopause shines its dry pores, even though mentally we are physically not on pause. Now, these are some of the organs that we learned about with GIST, and there's a whole lot more to shout out with Bliss. So for sure, we'll be back soon with season 2, more learning, fun coming soon. My name is Empress Dion, and I would like to thank the African Liberation Network and Jad Daniel for his dedication and continued support for the HSR family. I would like to thank Empress Miriam for putting this family together with the likes of Royal Empress Rachel, Royal Empress Cindy, Royal Empress Trisha, Honorable Jack Clark, and my silent supporter, Honorable Empress Lily Mee. I give thanks for all wisdom, knowledge, understanding, and courage from being amongst the acts. And I can't wait to share the joy of season 2 with you. Holy Marcus I, Holy Emmanuel I, Selassie I, Jah, Rastafari, Holy Queen Omega I, Selassie I, Jah, Rastafari. Give thanks, my Lord and Empress, blessed love. And to my royal YouTube family, stay happy, stay beautiful, stay healthy, stay blessed. Till we meet again. Blessed love. Honorable Empress
Well
Maisie.
said. Well said, honorable family. And this is the closing. I will just what chorus, Lord? Empress Meme, we love you. You know what life is worth. Empress Meme, we adore you. For you teach the little children and you feed the little children. Empress Meme, we love you. You're the mother of the earth. Oh, Empress Meme, we love you. You're the mother of the earth. Empress Meme, we adore you. You know what life is worth. For you teach the little children and feed the little children. Empress Mem, we love you. You're the mother of the earth. Oh, Empress Rachel, we love you. You're the mother of the earth. Empress Cindy and Empress Diane, we adore you. His word for you teach the little children and you feed the little children. Empress Mem, we love you. You're the mother of the earth. Jovia Jah. Rastafari, give thanks and praises. It's a wonderful night. And may God continue to bless my family as we start to do season 2. I'll hand over the floor and to the Honorable Prophet Jack Clarks. Give thanks, Honorable Jack Clarks, for being with us, and to strengthening I and I as you do your findings, my Lord, and you are the one that covered. When the sisters them done, you covered everything. We give thanks, Jack Clarky. I love you, Majesty. I love Ja Daniel. I love all my listeners. May God continue to shine his blessing upon all I and give us the strength and power, to go forward in this life. Holy Emmanuel, I, Selassie, I, Jah, Rastafari, and over the fort to Jack Clarky. Blessed love.
Oh, blessed love to the royal family. Well, everything was said and done, and I, as a humble child, Mama speak, give thanks to be here, once again, with all the royal goddess, give thanks to all humbleness, give thanks to the order, Melchizedek, give thanks to the Ethiopia Africa Black International Congress. Give thanks for the health and strength and the restoration vibes, from that time, a whole year, chatting with the royal goddesses, learning about the goodie, give thanks, for everything, just humble and blessed, And of course, give thanks to the blessed chorus from the royal empress, Mama, out of love, our strength going through this segment, powers and strength, powers and strength, powers and strength. Love, love, love to the royal gods and goddess, my Lord, to the royal family, to the royal viewers, out of love, salutation and peace to one and all. Most High, Selassie, Jah, Rastafari. Yes, Mama. Close with a prayer. Jah Daniel?
Yes, close with the prayer.
Yeah, continue on chanting. Yes, on the hour. The 100th Psalm. Make a joyful noise unto the Lord, all the lands. Serve the Lord God with gladness. Come before his presence with singing. Know ye that the Lord our God, he is God as he had made us, and not we ourselves. We are the people and the sheep of his pastures. Enter into his gates with thanksgiving and enter his courts with praise. Be thankful unto him and bless his holy name. For the Lord is good, and his mercies everlasting. And the truth of the Lord endure to all generation. Holy Marcus, Holy Man, Malai, Selassie, Jah, Rastafari. Yes, that none here you hardly saying there's nothing you can do. And the souls of men and women are dying, and the Master calls for you. Take the task he gave us gladly and let his work his pleasure be. Answer quickly to the health, strength, and restoration family. Here I am, send we. Most High, Selassie, Jah, Rastafari, I love my Lord.
My Lord, Honorable, give thanks.
Yes,
And
my
of the
Lord.
prophet Jah Daniel, my Lord.
Yes, I. Blessed love, my Lord and Empress. Give thanks for another program, complete. Give thanks for the completion of the first season. of the program, the health, strength, and restoration. Give thanks for all the participants and all the viewers. Yes, and, we look forward to, the next season and when we can present again. So, stay tuned. Until such time, our guidance and protection, going out and coming in from this time henceforth and forevermore. Say the Lord our God, the Black Christ in flesh, Holy Emmanuel, I, Selassie, I, Jah, Rastafari. Blessed love, my Lord and Empress. Glorify.
That's the word.